Medicare supplement insurance plans are standardized, with most states offering 10 Medigap plans labeled with a letter. A Medigap Plan G provides the same coverage whether you purchase it in Nebraska or Arkansas. A Plan F with Aetna insurance is the same as a Plan F with Americo insurance. However, Medigap policies are standardized differently in Wisconsin, Massachusetts, and Minnesota. Hi, I'm Rick Teska with Senior Market Solutions, your Medigap insurance advisor. You may recall hearing this information in some of our other Medigap-focused videos. I encourage you to subscribe to the SMS YouTube channel so you don't miss out on any of our new content. In this video, I'm going to answer the question, how do Medicare supplement policies in Minnesota work? I'll start by outlining Minnesota basic benefits, followed by Minnesota Medigap policy coverage options in 2020, then legislative changes that may affect Minnesota beneficiaries in 2019 and 2020. So let's look at the Minnesota basic benefits. As I mentioned, Medigap policies in Minnesota are standardized differently. Minnesota offers several Medigap policy coverage options. We'll circle back to discuss 4 of them in a minute. But let's start by reviewing what they all have in common. Every Minnesota Medicare supplement covers a set of basic benefits. Number 1, Medicare Part A coinsurance. Number 2, Medicare Part B coinsurance. Number 3, blood, the first 3 pints of blood per year. Number 4, Part A hospice care. Number 5, Parts A and B home health care. And finally, number 6, Minnesota state mandated benefits. Now let's dig into 4 Minnesota Medigap policy coverage options in 2020. Number 1, the basic plan. Number 2, the extended basic plan. Number 3, the copay plan. And number 4, the high deductible plan. The basic plan is essentially your a la carte option in Minnesota. It allows you to design a Medigap policy that fits your needs and your budget. The basic plan starts with the Minnesota basic benefits and also covers foreign travel emergency. From there, Minnesota offers these 4 optional riders: the Part A deductible option rider, the Part B deductible option rider, the Part B excess charges optional rider, and preventative services not covered by Medicare optional rider. Beneficiaries may choose any of or all of these optional riders, so it's easy to customize the basic plan to meet your unique needs. The basic plan has no annual out-of-pocket limit in 2020. Moving on, the extended basic plan is virtually identical to the standardized Medigap Plan F, available in most other states. The extended basic plan starts with the Minnesota basic benefits and also covers the Part A deductible, the Part B deductible, Part B excess charges, Medicare covered preventative care, foreign travel emergency, foreign travel medical care, and preventative services not covered by Medicare. The extended basic plan option has a $1,000 annual out-of-pocket limit in 2020. The copay plan and the high deductible plan are 2 newer plan options. While they're growing in popularity, they're not offered by all insurance companies. The copay plan starts with the Minnesota basic benefits and also covers the Medicare Part A deductible and foreign travel emergency. Beneficiaries are required to pay a $20 copay for office visits. The copay plan has no annual out-of-pocket limit in 2020. The high deductible plan covers everything the copay plan does. However, Medicare beneficiaries are required to pay a deductible which is set by the carrier. The high deductible plan has a $2,340 out-of-pocket limit in 2020. This detail is small but costly, so I encourage you to evaluate your options carefully. Legislative changes in 2019 brought big changes to Minnesota Medicare plans. Medicare cost plans are sunsetting in 2019, which affects a large population of Minnesota beneficiaries. If your cost plan was discontinued in 2018 or will be discontinued in 2019, you have a special opportunity to change your coverage before the end of 2019. Beneficiaries who enrolled in a Medicare Advantage or Medicare cost plan for the first time get a trial right, which allows you to disenroll and return to original Medicare. You also benefit from a guaranteed issue clause, which means you can purchase a Medicare supplement without answering any health questions or going through any medical underwriting. For most Minnesota beneficiaries, the trial right will expire at the end of 2019. You have a very short window of time to change your coverage, so I strongly encourage you to schedule a free consultation with one of our licensed Medigap insurance advisors. 2020 brings even bigger change. Under recent passed legislation, Medigap plans will no longer be allowed to offer coverage of the Medicare Part B deductible. In Minnesota, this means the Medicare Part B deductible will be eliminated from the extended basic plan and any additional rider options. Current Medicare beneficiaries with Part A and Part B enrollment dates prior to 1/1/20 will still be able to retain and/or buy this coverage. We've created a new YouTube playlist with educational videos that talk more in depth about related topics like cost plans sunsetting in 2019, Medicare Advantage misinformation, top 10 things to know about Medicare supplement plans, top 10 disadvantages of Medicare Advantage plans, Plan F changes in 2020, Medicare Parts A and B. You'll find a link to this playlist in the description below. Now, if you're feeling overwhelmed, don't worry, you're not alone. At Senior Market Solutions, our specialty is Medicare supplements. We know the ins and outs of the Minnesota Medigap market, and we have plenty of experience working with folks and the uniqueness of Medigap plan options in Minnesota. For Minnesota beneficiaries, especially those who are new to Medicare, SMS is your perfect partner. At SMS, we work with all of the top companies such as Aetna, Cigna, and Mutual of Omaha, so our customers get the best rates available. Book a free Medigap consultation by calling us toll-free at 1-855-784-9649 or click the link in the description to book your appointment online.